began realizing that I had some kind of a problem, probably about 30 years ago. And my original doctor was Dr. Waters, who was here. So I was seeing Dr. Waters, and he did stents for me a couple of times. It's been nearly 15 years ago. I had a major heart attack. And then after that, I had a very, very weak heart and congestive heart failure. And the congestive heart failure continued to get worse until last year. I had an episode where I couldn't breathe well and went to the hospital. And then the next day, Dr. Askins, who actually has cared for me for the last 15 years, he came in after the next day and said, would you like to try this? I'm not even sure what he told me it was. It was just like, yeah, I'll do that,
Well, Marilyn, Davidson's a patient that I've had for approximately 15 years. And she has coronary artery disease and most of the manifestations that can occur when people have a severe form of that disease. I think it was last year she became progressively short of breath to the point that the medications just weren't able to keep her very comfortable. So we started talking about the options of cardiac transplantation. But I also brought up the possibility of her receiving a LVAD, which stands for left ventricular assist device. The heart pumps so many quarts per minute, in essence, normally, and hers was down to the point that it was just a fraction of what is normal. And so what the LVAD does is it boosts that back up to circulate more blood to all the tissues and restore more normal nourishment of all the tissues, the kidneys, the brain, muscles in the legs, and so forth, so the patients can lead a more active life.
They did open heart, implanted a machine under my heart, a pouch under my heart.
The only thing that comes through the skin is the power line for the electrical current that drives this thing. And then the patient has to have some batteries, and I think there's usually 2 batteries.
Most people have to carry a little bag, but I just have a dear friend who made me these cute little vests, and I have a selection of them, so I'm not just tied into any one thing. I would say, okay, do you want me to cook dinner? And it would be steak and salad. Just the easiest thing I could put on the table. And I slept a lot. I'm able to do my grocery shopping. I, bake brownies and cook real meals again. They're still very simple, but I still have gotten back to where I'm really cooking. Done laundry, and I'm not just exhausted from it. Have plenty of energy to continue taking care of the things that need to be taken care of. And so I just feel 100% better probably at this point.
Obviously, there's a lot of things to accommodate to, keeping up with the batteries and wearing the vests and guarding against infection, all that type of stuff. And Marilyn's done very well. And as the case with so many illnesses that we have and things we have to do as we go through life, her attitude has just been great, and she's accommodated to it very, very well.
So there are things that are not convenient about it, but it's certainly worth the exchange and the price that I would have paid otherwise, because now I can still continue to do things, go places, made my life a lot more pleasant. Had I not had this done, if I had not opted for this, I probably would have died by now, and definitely would be bedridden. Do always pay attention to what your body is telling you, because you know it better than anyone. Regardless of what it is you're going through, you know how your body should feel. You need to pursue anything like that. You need to know what your options are at all times, whether you have a small problem, a large problem. Don't just talk to your friends about it, but really speak with your doctor and know what is available to you and what the options are going to be if you if you choose to do it or not do it. You know, it's a little unwieldy on occasion, but it keeps me going.